Good morning, everyone. Today is Thursday, May 7th. The Council's meeting again today to continue the review of the FY27 operating budget and capital improvements program. Council member Sells is attending this week's meetings virtually. The first item on the agenda is the budget consent calendar for FY27 operating budget and FY27-32 capital improvements program. Is there a motion to approve the budget consent calendar? Moved by Council President Balcon, second by Councilmember Jawando. All those in favor, please raise your hand. Councilmember Sells, I cannot see you. Okay, you can say she's absent.
Oh, she raised her hand.
Is she? I can see that. Okay, I trust you guys. All right, fine. And with everybody present, we're missing Councilmember Glass, who's on his way here. And now we will discuss individual department budgets, and we're going to start with FY27 operating budget and FY27-32 capital improvements program. The first one is Department of Health and Human Services, Public Health Services. I asked Councilmember Dawn Lukey to give the report as she's here, and the chair of the committee is virtual. So, Councilmember Lukey, please take it away.
Sure. Thank you, Madam President. And since we're going to go through a number of HHS, that's a minimizing of the term, a number of HHS items today, some which were solo HHS committee items, some which were joint. So when we get to the joint hearings, we will turn them over to our chairs for ENC and PHP who led those discussions. Everyone, I think, is very aware of how important all of our HHS services are at this time to our residents. I think every one of us is getting a steady stream of calls and emails and in-person conversations related to the various services that are provided by our Department of Health and Human Services and their contractors, and those are the services that address our most basic human needs, protecting our community's most vulnerable, our children, our elderly, families. We offer through DHHS over 155 programs and deliver services at more than 20 different locations throughout the county. In addition to the core services that are provided by the department, they're also responsible for budget and fiscal administration, contract management, facilities management, grant acquisition, human resources, information systems, and performance management. And I want to thank our team from DHHS who is already seated up here in the front, as well as those who are assembled here, because I know you all will be switching seats at different times as we work through things. But each and every one of you are dedicated public servants, and we truly appreciate everything that you are doing to help us navigate through these challenging times. With respect to the overall budget picture for the agency, the county executive recommended an increase of $18,913,060 or 3.39% over the DHHS FY26 approved operating budget. Of that increase, $30,606,294 is in the county general fund, $378,740 in opioid abatement funds, and there is a decrease of $12,071,974 in the grant fund. The county executive recommended an increase of 50.15 FTEs, an increase of 2.4%. The executive's recommendation includes $43,728,543 in programmatic and staffing enhancements. The recommendation also includes a $12,590,842 in programming and staffing reductions. The recommendation includes an $8,938,376 increase for FY27 compensation adjustments and $2,011,453 to annualize FY26 compensation increases. With respect to our operating budget equity tool analysis, DHHS received an OBIT score of 6 out of 11, reflecting a sustained commitment across all areas of the GARA framework, including advancing equitable outcomes for county residents in addition to DHHS staff and contractors. For logistical purposes, during our committee work sessions, we worked through the work of DHHS thematically, which is not the way we will end up doing it here at full council. Here it is organized by how our budget books are organized for purposes of how we'll run through things today. And then the last piece before we turn to our public health services is I wanted to provide a little bit of an overview since the department has undergone some restructuring. And in order, we may have heard things coming up in different parts of the budget in prior years than where they are going to be relevant today because of this restructuring. So as a part of DHHS's efforts to reconfigure their operations, the Office of Community Affairs, including our equity and language access, was moved to the director's office within administration and support services. We established the Office of Social Services as its own service area. The Child Welfare Services and Office of Eligibility and Support Services from Children, Youth, and Families was relocated, and established the Social Services, Constituent Services, and Quality Assurance. Within the Services to End and Prevent Homelessness, we established 5 primary divisions: administration, homeless services, housing stabilization services, healthcare for the homeless, and supportive housing, to align program areas with staff structure and program delivery. In the Public Health Service, they established the Community and Population Health as a new program within the Public Health Service, including key initiatives that were previously housed in other parts of the administration, including Healthy Montgomery, Health Promotion and Prevention, and the Mobile Health Clinic. For children, youth, and families, there are 3 new program areas: Community Action, CYF Special Projects and Initiatives, and the Lighthouse. And they renamed Positive Youth Development Program area and the Community Youth Violence Prevention and Intervention Program. Child care subsidies and Head Start have been shifted to Early Childhood Services within Children, Youth, and Families Division. And then in Behavioral Health and Crisis Services, we have 2 new program areas: Prevention and Harm Reduction Services, School-Based Mental Health and Related Services, including Education Support, Therapeutic Mentoring, Linkages to Learning, and High School Wellness Center Services that were all previously in Children, Youth, and Families, now in Behavioral Health and Crisis Services. Aging and Disability experienced minimal changes in this reorganization, but the primary adjustment involved the transfer of the Adult Medical Daycare Program provider supplement from Aging and Disability Assessment and Continuing Care Management Services to Aging and Disabilities Community Provider Support, which aligns with our developmental disability and adult medical daycare supplemental funding, with a single program area, improving consistency, administrative clarity, and oversight of resources directed to community-based providers. And I'll note, before turning it over to our lovely central staff team for HHS, that they conducted a base budget review for aging and disability, which can be found on circles 10 to 23 of your packet for today's work session on aging and disability. With that, I'd like to turn it over to Ms. Clemens Johnson and Ms. Hernandez Rodriguez.
Good morning, and thank you so much. Not too much to add. I do want to thank our DHHS and Office of Management and Budget team with the volume of requests and responsiveness. We really appreciate it. And so, as you illuminated that this year, instead of doing one huge packet for HHS, even though the separate packets are still huge, we hope that this is more digestible, if you would like to say. I think I can stop there. There were several questions that were asked during the work sessions, and we tried to ensure that that information was included in the packets, especially regarding some council member requests and committee additions. So I will stop there and see if Ms. Rodriguez Hernandez. Okay, we're all set. So as soon
Thank
as
you
wanna
so
walk through the
much
packet,
for that recommendation and for your comments. I'm going to turn it now to the Director of HHS.
Good morning, and thank you, Madam President, Madam Vice President, the HHS committee, Councilmember Friedson, Councilmember Lukey, and joining us virtually, Councilmember Sells. Councilmember Lukey, you hit the nail on the head. It's a complex agency. It's the only integrated agency within the state of Maryland out of 24 jurisdictions. And that's a lot. Normally, I would render my soliloquy that walks through all those complexities, but I will spare you that this morning because we got a lot of work to do.
Yes, we do.
We have multiple sessions, and over 7 days, we went through a lot. Their recommendations, and I also want to thank central staff. They were amazing in working and responding and working with our team so that we could provide you with the answers that you asked for. Also, with our community partners, we hear you, we understand, and the work continues. Regardless of the outcome of our budget sessions, there's a lot of work to do. The federal level is an imminent threat, H.R. 1. And so we've had multiple work sessions around many discussions, and they will continue. So I thank you for acknowledging the recommendations that's put forth by the county executive, and I look forward to a robust discussion. Our team is assembled here, so we will play musical chairs today. We want to respond to your questions to make sure that you have the answers to make the right decisions to support our budget.
Thank you so much for that. I'm going to open it up to colleagues to see if anybody has any questions or comments on this particular aspect of the HHS service budget. If none, we have a committee recommendation for this particular on police services. We are on item 2 right now. Are there any questions for this first part of the HHS budget? That's what I'm calling. It's going to be a long day with HHS, and I'm dividing it. So I'm going to start. I'm going to start with Councilmember Kate Stewart.
Great, thank you. I know we have a long day ahead of us. I did want to just say thank you to our public health services and all the work that you are doing. And to note that on the reconciliation list, I did request the additional money for MoCo Pride. And I understand the tough budgets. I've talked to each of you regarding this, and I would just ask my colleagues, even with the difficult budget, to consider at least one of the tranches for the MoCo Pride Center, given the work that they have been doing in our community. I also want to acknowledge that the work that they do in our community does go beyond what the Department of Health and Human Services does. The work they do is encompassing of many things in our community that go beyond the work of public health. And at a time when we're seeing our LGBTQIA community under attack, and even this week, unfortunately, our public schools needed to revise their programming and their guidance on keeping private information of students. There is a lot of need, and we have heard from the community the importance of having spaces, programming where members of our community feel safe. And so I just want to thank you all for the work you've been doing on this. I know your budget is really tight, and I ask that even as we look at where is the best place for the MoCo Pride Center and all the services they provide, that my colleagues consider taking off on the reconciliation additional funding for them this year. Thank you.
Thank you so much for that. Next, I have Councilmember Kristen Mink.
Thank you. Agree with. I want to agree very strongly with the words of Councilmember Stewart and the importance of the work of the MoCo Pride Center, and appreciate her for lifting that up. These are essential services, and they are for a community that is very much under attack in a lot of ways from the federal administration and even in other states and other counties. And I'm proud that here in Montgomery County, we take active steps to move in the right direction. I did want to lift up and make a motion on one item that is, I think, one of 3 items that fits a criteria that we talked about yesterday. It is an item that was in last year's.
I'm going to have to interrupt for 1 second,
Sure.
and I hope everybody saw the email from Mr. Howard this morning.
Yes.
Yes. I know I think we got really creative yesterday, and we moved to have the BlackRock to the base. We should have not done that. And so it needs to go to the rec list like every single other item so we can be consistent. So nobody is going to be putting anything on the base. We're going to treat them, as we have said from the beginning, per the guidelines that we received from our director. And I apologize that we were carried away yesterday, but it's okay. I know I personally will be supporting the BlackRock when it comes to the reconciliation list and many of these HHS items. So we're going to be consistent. So I just want to say that.
Thank you. Are we taking a vote on BlackRock? Because we had took a vote on it yesterday, I think.
I don't think we have to, but if you guys want to, we can do it. But
And I think,
we can do it.
okay, I'm not going to make a motion for it, and I'll just note that I'll just say that I understand the concerns about. Yeah, I want to first acknowledge that I understand the concerns that are being lifted up. We can't just go moving everything into the base right now. We need to go through a thoughtful and deliberative process. Completely understand and respect that. This is a very difficult budget process, and we want to be thoughtful and deliberative. The criteria that was talked about yesterday implicates 3 line items. I would have some concerns about basically undoing my vote yesterday because I think that we have sent a message to BlackRock and to the community, as well as to, for example, the George B. Thomas Learning Academy, who also falls into that category of items that were in the previous budget, that we expected to be in this budget, and that the county executive sent over a correction for. So I think a number of us have indicated our support for within at least that limited criteria, doing that with the George B. Thomas Learning Academy. And despite the gymnastics that went around those items, I think that we were aligned on that being important, and on that basis also then giving the same consideration to BlackRock, and hence the vote yesterday. The third line item, which is the only other one as I look through the reconciliation list that falls directly under that criteria, is American Diversity Group, which was in the last budget. We expected it to be in this budget, and it did not come over initially, but County Executive Elrich sent it over as an amendment. So that, to be consistent, my motion today is to move American Diversity Group into the base, and just as I will support moving the George B. Thomas Learning Academy later, and as I supported BlackRock yesterday.
The good thing is that those 3 items were part of the amendment that the county executive sent to us.
Right.
So it's in the same group. And
Right.
the same category group, yeah, the same thing. So I don't mind, and I'm committed to vote on another reconciliation date. But because it was sent to us through an amendment from the county executive, I think it's okay. We can just take the vote now if people are okay with this. We all heard about the 3, we all know these 3 different items very well. So can I get a motion?
So I'll move to move American Diversity Group into the base.
All the 3 items from the amendment from the county executive, second by Council Member Andrew Friedson. I'm going to allow discussions right now. I think you want to go first. Go ahead, Andrew.
Yeah, thank you. And then I have other comments about this budget, but I want to talk to this item.
Just do the amendment.
So I just want to make sure I understand. I fully appreciate the council president's perspective, having been in that chair. It's very hard when things don't follow process. I do think that there are certain guardrails here that have been noted by Councilmember Mink, where there are a few items that are a little bit different, where the county executive has acknowledged a mistake. There have been more mistakes than I'm comfortable with here, but it was a mistake, and the mistake was sent over. It is not up to the county executive to determine what we do with the mistake, but it is up to us of whether or not we want to just acknowledge that that's a mistake and reestablish it in what we think is appropriate. The criteria would be, it was funded last year, so not funding it would be a reduction in service, and that it was sent in an amendment, and the amendment acknowledged that it should have been there. And in the case of ADG that was noted, or in the case of George B. Thomas, it didn't find a home. The thought was it was put into MCPS and was included in the MCPS budget request, as was noted. That's why I, moved the way that I did, because I was trying to follow what the county executive did, but ultimately didn't do. So my clarification here, and I appreciate the council president and Councilmember Mink on this item. Are we voting in block for the 2 additional items that are similar to the BlackRock item to include in the base, or are we going to take up George B. Thomas separate? I just want to make sure that we understand, because it was a little bit of confusion here, but I just want to make sure.
I think the same should be fair.
It's as a block, and we
as a block, yes.
And we discard this item. So I'm seconding that motion. I appreciate that, and I agree. I have also looked through the reconciliation list, didn't see other items that would meet that criteria, because I do think that there need to be some guardrails to be fair to every organization and every grant and every program that we all would like to fund, but possibly won't be able to fund given the budget constraints. So thank you.
Councilmember Wojo-Wanda.
Thank you. And if I could third it, I would third it. I think this is fine to do that. And I'll just say what I was going to say about George B. Thomas briefly now, since this is where we're making the motion. I'm glad they're not going to spend, and I'm glad ADG won't spend. I was just with them at the Asian American Pacific Islander event, as many of us were. They're a great resource in our community. They serve people that no one else serves. And then George B. Thomas is an amazing program that had a home at HHS, will continue to be at HHS until further notice. And we had the superintendent here the other day who said, we want the program to stay, and so the confusion aside, neither one of these organizations need to spend the next 6 weeks on the reconciliation list, or next couple weeks on the not six.
Definitely not 6 weeks.
Six days or whatever it is. It feels like 6 weeks, but it's, and the families that have signed up and people who need services should not be wondering whether they're going to be there. So I am really happy that we're going to do this. I think they are in a unique situation, and I appreciate Mr. Howard's guidance, and I know it gives you some heartburn, but I do think these are a little different than the others. So I will happily support this motion. Thank you.
I see Councilmember Lorraine Sell's hand.
Yes, I just want to echo the sentiments of my colleagues. I want to thank Councilmember Lutke for giving such a great report out. And thank you, Councilmember Ming, for lifting up these 2 incredible programs. The ADG group that is working on the weekends to serve our residents with the highest public needs and who need access to specialty care, especially on the weekends, because they are working so hard during the week. And then, of course, the George B. Thomas Learning Center. I am so glad we are coming together to ensure that, our youngest learners will now have the after-school tutoring support, mentoring support that is so needed during these times. And so just want to thank my colleagues for these motions and the introduction to this session, and look forward to voting in support of these items. Thank you.
Thank you very much. I don't see anybody else wanting to speak. All those in favor of the motion? All those in favor of the motion, please raise your hand. Any passed unanimously. Thank you. We're going to continue this. I see folks wanting to speak on the rest of this particular. The staff can do it then at this point. Can you please go on to the rest of the particular report?
Yes, so we are talking about the public health services area.
Only the services. We're only in that section. Yes.
Yes. So there are a number of items that are listed on page 1 and 2 under public health services. One of them It also includes school health, which will be discussed by the ECHHS chair. If we start on there are no page numbers. If we start on page number 2, the first item is the Montgomery Cares primary care reimbursement rate increase to 52% of the cost of care for $78,000, 78,000 encounters, $1,564,817. This will take the reimbursement rate, I believe it's $113 to $130 and 82 cents, and the committee recommended approval.
Thank you. Can you go through the whole service? Is that anything else you want to add?
No, I mean, I will be, there's around 20 items.
No.
So I don't.
I'm going to open it up for questions in case people have, but thank you for that. I'm going to start with Councilmember Kate Stewart.
Sorry, I just wanted to go back because I am fully supportive of what we did, but I do want to acknowledge that for MoCo Pride, they were funded at $500,000 last year, and then this body added an additional $500,000 in the fall. So I understand where HHS is in their overall budget and having conversations about this. So I just wanted to make sure colleagues understood where the MoCo Pride Center thought they were with their budget moving forward. They do have the one center in Bethesda. They are opening another center in downtown Silver Spring. And you have all the reports. We don't have to go into great detail, but I would just ask my colleagues to seriously consider taking them off the rec list as you go through it. Because we just talked about a number of organizations that thought they were getting a certain amount of money. They were not in the original county executive's budget, and now we just put them back. And I understand that process, and I'm not, because we got sent over amendments from the county executive. So I'm not asking us to open up or do anything differently. So I won't move it, but I'm just really asking our colleagues to think about what was the budget of the MoCo Pride Center, what we have committed to them as a county government, and what we can do for FY27. Thank you.
Thank you. Council Vice President Balcom.
Thank you. Just following on the Councilmember Stewart's comments. It's been this conversation's been a difficult conversation in terms of what the agencies thought they were going to get, what initial budget that came over, and then amendments that came over. When we invested in the MoCo Pride Center, it wasn't one-time money. It was to establish this very important resource in our community with the full intention of continued funding. And so I do think the first mistake the county executive made was to not put it in the original budget. The second mistake was to not include it in the amendments. I am fully in support of the center and will be supporting this MoCo Pride Center. Thank you.
Thank you. Next, Councilmember Andrew Friedson.
Yeah, thank you for that. A few things. One, I want to talk about the MoCo Pride Center. Two, I want to talk about our team. Appreciate all the work that you do. It went very unheralded for decades until COVID happened, and then now everybody is aware of the central importance of public health and how public health is personally important. And it doesn't matter who you are, but not having outbreaks of infectious diseases, making sure that we have healthy residents, ensuring that we have education, understanding how to keep ourselves healthy and well, that matters a lot to all of us. And you all have been doing that work forever, unheralded for a long time, but certainly came to the forefront, and I hope continues to be in the forefront because it's important. HHS has been asked to do everything. So I just want to acknowledge that. I tried to acknowledge that during committee. I'm going to re-acknowledge it here and maybe do a little bit better this time. I appreciate what HHS has been trying to do, which is to focus on core services, to say we do health and human services. That is our job. That is our role. And I do think that we need, and you need, help from the second floor and from other aspects of county government to take on the responsibilities that are outside Health and Human Services, because we can't expect you to do public health and to do Health and Human Services, which has more needs and more challenges and more strain than ever before, and do a bunch of other things that are pretty much unrelated to what you do. And that's where the challenge and the connection, I think, with George B. Thomas, even though it's not part of today's agenda, although we just voted on it. And that's, to a certain extent, where Pride Center is, where Pride Center does provide public health services. However, that is one piece, and a relatively modest piece, of a much broader suite of support and services, which the department has acknowledged and said, we think it's great, it's just not what we do. And it's understandable for you to say, this is what we do. If it's outside of our core competency and our scope, then someone else should take this on. And I think this is a broader issue and a broader challenge. And I just want to lift that up and let you know that I appreciate that. I think the challenge that we have is it's very hard to litigate that in the middle of a budget process for you and for us. I don't think it's been fair to you. I don't think it's fair to our partners and those who are being served by those partners for us to be debating and discussing these, because I think some of the views are conflated as if the department doesn't care or is disinterested in some of these issues, which I don't think is the case at all. But I think it is an acknowledgement of you can only do what you do, and there are certain things that you've been asked to do that are outside of what you do. And so I just, I want to note that and just center that issue. Having said that, that doesn't change the importance always, but particularly in this current moment, of the services that the Pride Center provides to many people in our community. And I am very supportive of that. I do just want to reiterate and acknowledge Councilmember Stewart has been championing this cause since before it had a name, and since before we put any funding in, and has been its leading advocate and has been out there at the forefront on a personal level, on a professional level, with every ounce of her being. I've seen it privately, I've seen it publicly, and I just want to express my appreciation for that. And I want to express my appreciation for everybody who has been involved in this center, because we leverage a lot of volunteer support and community-based support that we otherwise wouldn't have if we weren't providing the county support. So very supportive of this, whether it's on the rec list or in the base budget or otherwise. We really need to fund it because it is a commitment that we have made where we are going to be partners to provide these services, and I'm hopeful that we can move forward. And I think medium and long term, we need to be really thinking through where it is housed, because the larger portion of the services are probably outside of Health and Human Services, and I think it's only fair to make sure that we're only asking you to do what you do. So with that, I'll yield back. Thank you.
Thank you. Next, Councilmember Glass.
Thank you for the discussion, and I want to lift up what Councilmember Friedson just said in appreciation of Councilmember Stewart for helping lead this effort. But I want to take one step back. I appreciate all colleagues sharing their thoughts, but I think it's important to ask the department, why is the MoCo Pride Center not getting the funding that it did in the last fiscal year?
So the county executive recommended $500,000 with the inflationary adjustment, which is what he recommended in the previous fiscal year. The additional $500,000 was added as a supplemental by the council. So his recommendation is consistent with his recommendation last year. Last year he didn't recommend the additional $500,000 that was done by council. Does that answer your question, Councilmember?
That is a factually accurate statement. I know all of us have heard that there are different sides to different conversations about what commitments were made and what were not made. And the reason we stepped in with that supplemental was because we were informed that commitments were not made. So we wanted to make the MoCo Pride Center whole. Understand that. It is unfortunate that the county executive does not see either the full potential of this organization or the need that it currently serves and can continue to serve. I don't want to belabor the point that my colleagues have all made heartfelt comments, but of all the things that we are doing right now, we are working so incredibly hard to make sure every resident feels welcome, safe, and seen. And we are introducing legislation to block and stop ICE. We are introducing legislation to protect our neighbors. And this is funding that we know will go a long way to improving and expanding our inclusionary values. So I support everything my colleagues have said. It's unfortunate the county executive did not continue supporting this at that record level, but once again, appreciate my colleagues and appreciate Councilmember Stewart.
Thank you for that. Again, we're only discussing item 2 of the HHS budget is public health services, and there is a section, and Councilmember Lutke mentioned this, that was actually done in a joint committee, and I'm going to turn it now to the chair of Education and Culture because it's on the last page of the report. So please go ahead.
Thank you, Madam President, and I want to associate myself with the comments about the Pride Center and thank Councilmember Stewart for her advocacy, and I will be supporting it on the reconciliation list as well. The nurse management staffing ratios, I think, is the first item that we discussed, and the dynamic duo will correct me if I get anything wrong. This has been a continual issue. We had it's Educator Appreciation Week, and I was with some of our nurse folks, and I know we have a former school-based nurse and a former supervisor, and yeah, okay, you're not nodding, but you're just looking at me. I thought so. And we've talked about this over the years. And so last year we added additional 3 nurse managers. Currently, there's 16 managers that oversee 395 merit school staff, 165 merit school nurses, and 230 merit school health room technicians. The current policy for school nurses is 1 nurse per high school, 1 nurse per middle school, and 1 nurse per every 3 elementary schools. However, each community school requires a dedicated nurse as well. So there's 80 community schools for the upcoming year, which is a good thing, but that also increases the number of nurses that we need. And we want a ratio of 1 to 8. And so the 5 new nurse managers that are recommended would reduce the ratio from 1 to 25 to 1 to 19, I think that's correct. And this is a 6-month lapse. This was a 5-0 recommendation to annualize the cost at $340,055 for all 5 positions, which will continue our progress. I think it's an important step to take, and I concur with the Joint Committee recommendation, and that was that item. Do you want me to go through all of them or stop there? Okay. The next was the Head Start contractual nurse staffing to annualize for our youngest children, the appropriation there that was made supplementally of $261,000. We approved a supplemental to supplement the reduced funding in federal Head Start grant, unfortunately, and to fund the 5 contractual nurses for the Head Start program, the county's Head Start program at 9 schools. Without this funding, there'd be a reduction in service and could place the program at risk. This was a joint 5-0 recommendation as well. And then the third item was the 2 school-based health centers, somatic services, moving it to 3 days a week. And DHS currently operates a school-based health center at 10 elementary schools that provide primary health care 5 days a week. This would be a reduction of $349,121. The executive's recommendation, while a reduction, I think is right sizing, and if you want to comment on this, you can. But to moderate utilization, they're not always used as much as 5 days a week. Do you want to just say anything about that? Because since it's a reduction.
Sure, yes. So the 2 school-based health and wellness centers that we would downsize operation to 3 days a week are South Lake Elementary School and Beers Mill Elementary School. These are our lowest utilized clinics, And so we feel pretty strongly that even with reducing, days of operation to 3 days a week, we'll still be able to serve students in those locations. And we have made plans that if somebody needs a service and it is emergent, they can go to another school-based health and wellness center. But looking at tight budgets and the cost to operate the centers, and thinking about what is going to have the least amount of impact to services to individuals, we felt as a service area that this was a good next step. So we have a plan to make sure that kiddos who need services emergently can get them. If it is not emergent, then they can be seen when they're open the next day.
Appreciate that. And that was a unanimous recommendation as well. Did I miss anything? Okay, turn it back to you.
Great. Thank you so much for that report. I see Councilmember Mink.
Thank you. Appreciate that. I wanted to just briefly highlight a couple items. The Muslim Community Center dental program, which I sent a memo about, that is one of our 2 Montgomery Cares dental clinics, 2 in the county. And the MCC clinic sees more patients and receives less funding. They have been making up, they have not received an increase in a while. And to be clear, both of the clinics are excellent and see a lot of people and need a lot of support. MCC has been filling the gap with private donations as best as possible, but it is a struggle. The demand is increasing. And so this is just a request that would bring them up to dollar to dollar parity, the same amount as the other clinic, to make sure that they're able to keep up with demand. And so appreciate your consideration on that. I'm sure that you can see the East County Dental Pilot has a very small increase. I just want to say, if we're not going to go line by line, I'll just say these items are all really important. This is a very bare bones budget request for what we all know is increasing demand, and these are a really high priority for getting off the reconciliation list for me, and I think it sounds like to colleagues too. So we're going to work really, really hard on this, and really appreciate HHS for putting the proposal together. But please do keep in mind that's the context of the MCC oral health program. And then also wanted to note, as we consider MoCo Pride, I know a lot has been said, but I just wanted but it is a large line item, and that is tough to get off the reconciliation list. So I am also going to be looking to make sure that makes it into our budget. These are critical services that are not provided elsewhere. And I will note that there was a reference previously to funding for a statewide organization. And I will just note that if that is a reference to Trans Maryland, that is the organization. Yes, it is statewide, but there is not a county alternative. If we are going to serve the trans community properly, this is who is going to do it. And in fact, Trans Maryland, I've seen the contract. Trans Maryland is in the contract. We are funding them intentionally because we know this is who does the work to serve this population. So I just want to make sure that the fact that they are statewide, that is indicative of the fact that there is not enough funding and support and safety in this space for there to be a bunch of local organizations supporting this community. So they are all together under Trans Maryland. They do significant work here in Montgomery County. We see them all of the time. Many of us know people who are or have been served by Trans Maryland, and it makes sense that they are written into the contract for the MoCo Pride Center as a large block of critical services that they are supposed to be and are providing, and that we have agreed to fund alongside many other important pieces of work that are there. So I hope that we're able to get that off the reconciliation list as well, and I yield.
And I just want to add that all those items that Councilmember Mick mentioned, they were agreed on in committee. It's 3-0 vote. I just want to put that on the record. So
Yes,
yeah, no, I know. Yeah. It's not a question. I'm just stating that that's what the report says, and it's important to say it on the record. So with that, we have a committee recommendation on the public health services, and it was amended in this session. Is there a motion to approve the public health services budget as amended?
So moved.
Moved by Councilmember Lutke, second by Councilmember Mink. All those in favor, please raise your hand. Is that a hand? Yeah. Okay. It's approved. Thank you. I can barely see it. So we're going to move on, turning it back to Councilmember Lukey, and now we're going to be in item 3, which is based on administration and support.
Yes, thank you, Madam President. So if you check the chart on table 1 and you look through the items that are in this particular packet, this was all just a sole HHS committee vote. We did recommend approval of all items 3-0 that came over from the county executive. And then I wanted to flag the committee's action on the tutoring service for youth and senior wellness services for seniors in the Vietnamese community. That amount of funding that had not been included or not been requested, there was a motion to restore this funding, which was voted in the affirmative 3-0 to restore the $92,638. So that will go on the reconciliation list for council's consideration. And with that, I'll turn it over to staff.
Nothing to add unless there are questions.
Thank you for that. I don't see anybody having a question. With that, we have a recommendation by the HHS committee. All those in favor, please raise your hand. And it passed unanimously. We're going to move on to item 4, Department of Health and Human Services, Aging and Disability Services. I'm going to turn it back to Councilmember Lukey.
Thank you, Madam President. There were a couple of items that I did just want to flag since these are critical and they are changes that we all need to be aware of. In our prior supplemental appropriation earlier this year that the council did related to our senior nutrition program, we do have a budget item here that the committee recommended approval 3-0 to increase funding for the senior nutrition program to help manage the increased food costs. We also grouped together both 2.5% increase for the Developmental Disability Provider Supplement, or DD supplement, that we have traditionally done, along with now, as I mentioned in my overview, our adult medical daycare is grouped together with our developmental disability services, and we have recommended approval 3-0 as well for a 2.5% increase for adult medical daycare providers. So those two sort of are in tandem, and that provides parity there. With respect to the other items, they were all non-controversial, not that those other ones were, but I did want to flag them since they were ongoing needs, and we do have, again, additional budget pressures at the state level that have created some challenges for our developmental disabilities community and the funding related to the services provided by them. And of course, the same with respect to our higher minimum wage and our adult medical daycare providers. And with that, I turn it over to council staff.
You pretty much covered most of it, but I'll just add on 2 really small things. There were 2 HHS committee additions as well. Mm-hmm. The first one being a $10,000 increase to the Commission on Aging's annual public forum. And then in addition to that was $60,000 to support the launch of villages in underserved areas. And that's on the reconciliation list in 2 tranches of $30,000.
And I did want to ask HHS to speak to that, but with, and I apologize for blanking on the villages discussion. I know it was robust at committee, but my understanding was that there was already funded allocated in the budget for our villages programs, and that there are already programs in the areas that this addition to the rec list would have covered. And I wanted to give Dr. McGee a chance to speak to that.
Yes, good morning, and thank you for that opportunity. Bear with me, I'm dealing with some respiratory issues.
Sure.
So hopefully you can hear me. So yes, the county has a startup fund, right? And that helps entities that are not already nonprofit entities, but in areas where they are wanting to start a village, interested in starting a village. And we will support those efforts. They will invoice us for whatever those costs are as they're trying to start their village. May it be getting their 501c3, so on and so forth. So those are the levels of support that we currently have with our startup funds. There are also, the Maryland Department of Aging has a grant fund, an aging in place grant fund that villages can apply to and get funding. So those are the two funding sources right now. What I tried to emphasize in committee was that we have a lot of consultations with emerging villages. Part of the challenge is infrastructure and leadership, sustainability, to keep it going. In addition to those grant funds that are out there, they are minimal, right? So being able to hire staff and keep the village up and running is a challenge and a chore. So if we're talking long-term sustainability, it's that that need for ongoing funding if the infrastructure does exist. So that's the part of the challenge.
Okay, and so is it the department's position that the committee's recommendation, because there were two tranches of $30,000 each, and I want to thank Councilmember Mink for attending that session and speaking to this issue, and specifically we were talking about Up County and East County.
Correct.
Two sites. And is it the department's position that those two tranches of $30,000 each to support that work is necessary or not necessary based on the other funding that is already being allocated for the villages?
It is the department's position that a village expansion is warranted and needed, right? And again, just highlighting the need for sustainable efforts in infrastructure and staffing. So the funding that would be made available through these two tranches may still be challenging for entities to sustain beyond that.
Right.
So the department's position is expansion is great. We would love to expand our village concept, right? And I think having more conversation about the use of those dollars and how we could sustain the efforts of the villages that would be developed is essential.
Okay. Thank you, Dr. McGee. I really appreciate it.
Absolutely.
Thank you. I'm going to turn it to Councilmember Friedson.
Thank you so much. First of all, the villages, huge believer in the villages. We had a robust conversation in committee about it. I think it's really important that we not only have a neighbors helping neighbors model, but that we have opportunities for that model throughout the county. It is not equitably distributed because it is self-directed and grassroots led. And so areas with more means and more resources naturally are going to have more likely organizations, and those with fewer are less likely. And I think this is primarily the function of government to step in to help. Now, the challenge is the sustainability long term. And I think that's where we're going to need to do a little bit of work. I think there are opportunities, and the villages are really thinking through intentionally about how they can help one another. So I do think there's an opportunity for the county to step in, but not to be the sole supporter of the other villages, where the stronger villages that have been around for a while have worked to do this. Could serve as fiscal agents, could help to get the organizational and operational, because the volunteer work is the part that everybody can do equally, but the organizational, fiscal, financial, reporting, all of that dynamics, you do need technical assistance and know-how and have to have done it before, and those who have been involved in county grants before and those who have done this work for many years obviously have a leg up. And so, leveling that playing field is going to be important, and I think really leveraging it. And in fact, perhaps in the funding that we do provide to the existing organizations, we could give extra, support for those organizations that are willing to help others. So it's not just what you're doing in your own community, but what you're doing to support other communities. So I think there's opportunities to think through this that take some of the pressure off of the department. We have one person who does an exceptional job, but one person covering the whole county is not a whole lot and is really challenging. And so I just want to acknowledge that. There's only so much you can do. And so, I just want to lift that up. I'm very, very supportive of that. Very much appreciate that. I think the department is thinking about this in the right way, and you won't find someone in a village in any leadership lay leadership role that doesn't talk about how grateful they are for the support that they get from this department. So just want to acknowledge that. Really happy about the DD and the adult medical daycare that we were able to move forward with, I think, a thoughtful recommendation. County executive put some of that in the budget. We recommended more on the rec list. This is really, really important, and I just want to lift that up. We have given a lot of credit throughout this budget for all the things that the state is doing to help us. This is an area where the state has really gone in the wrong direction, respectfully, and it is hurting the most vulnerable people in our community, those who provide services to our most vulnerable residents. And ultimately, the county has been a leader in the state and really in the country in stepping in to fill that gap. And unfortunately, the state is retreating to a certain extent. And so that gap is widening and not narrowing. And it's going to put a lot of pressure on us. I know it's going to be really challenging, but I couldn't think of something more important for supporting vulnerable communities than this. And so I just want to make sure I lift that up and note that. And we were very clear that the DD supplement and adult medical daycare, which has not always been treated fairly from my perspective, should be treated exactly the same. Whatever we do for DD, we should do for adult medical day. And I feel very strongly about that. The committee was uniformly in support of that. And so I just wanted to lift that up for colleagues that weren't part of the conversation. And then the last thing that I just wanted to, I have a couple questions on a particular item that didn't get discussed in committee based on some of the public testimony that we received and subsequent information that we've gotten. But Catholic Charities provided some very compelling testimony about a long-running program that they have called Community Companions that serves the disability community. I just want to understand, we've had a lot of dynamics with contracts and changes to those contracts. Just wanted to give the department an opportunity to speak to what happened with that contract that has been long running and serving some extremely vulnerable people in our community.
Absolutely. Thank you for bringing that up. We have, as you've stated, had a long-standing relationship with Catholic Charities to operate the Community Companions program for 10 years or more. At this point, this contractor has been significantly underspent in its contract. We've worked with them to increase their outreach so that they could serve more individuals through the service. And year over year, I mean, there's been years where it's only been 30% spent, their contract. So when we came to the table for FY26 budget, in the exercise of putting forth reductions, County Executive put forth a reduction to this contract, and the County Council approved that reduction. So that reduction took effect this fiscal year. So half of their contract was reduced as a result of years of underspending their funds. They are serving one less student this year than they did in the previous fiscal year, but they do report that they have increased the hours that those individuals are receiving. So there's been no growth in the amount of participants in the program, but those hours to the individuals that are participating has been raised.
Is there any plan of working with them, based on the recommendation, if we move forward in what is recommended, of how the department could work with Catholic Charities, work with this longstanding program to make sure that the vulnerable families who are being supported by this program have been supported by this program, which is not zero. It might have been less than what was originally anticipated, but has stayed level. And in fact, the numbers have stayed level, but the needs have grown. We've seen this, in many places. The school system talks about this. The enrollment's going down, but the needs of the students who are there have gone up. Is there any plan, any discussions that the department's having with them in order to ensure that the services continue?
Sure. Thank you, Councilmember Friedson, for that question. So this isn't specific to Catholic Charities. We find the challenges across all of the contracts that we support, that there is a need for technical assistance and support to help them understand the metrics, and that's why Mr. Hodge and I and our team have looked at data and how to assist with providing data that really speaks to the need, because sometimes the actual work doesn't represent the good to the community. So the short answer is yes. The department is really assessing all of the contracts that we have and how we can not only help them respond to the needs of the contracts and the statement of work, but how we can move forward. So the short answer is yes. We're working on a plan now.
Well, if you could come back to us with, what comes out of that, it's a significant concern given the challenges in the DD community, in particular with everything that's happening at the state level and the federal level and the lack of supports for these organizations. I'm just very concerned about us also walking away from some of these partnerships and responsibilities. So if we can ensure that those conversations are happening and move forward, and if there are certain aspects of this that aren't directly Health and Human Services, if they're providing some supports in Department of Recreation, for instance, can help and step in to take some of the pressure off of you, I think that would make sense. On this particular one, I can tell you that the current director of recreation has quite a background in some of these programs through Catholic Charities, and so I think conversations with that department would be helpful, and just ultimately making sure that even if we can't provide funding, that we're being partners and we're helping to support these communities and these community-based organizations that are supporting the most vulnerable people in our community. I think it's just really, really important, especially right now.
Absolutely, Councilmember Friedson and Director Albanos had a lengthy discussion yesterday, so the conversations are in progress.
I thought so. I appreciate it. I'm glad you said that publicly, and I appreciate you continuing to think through this and work on that. And I will yield back, Madam President.
Thank you. I'm going to say that I truly appreciate the comments by Councilmember Andrew Friedson, uplifting the committee work on the Development and Disability Provider Supplement. I'm glad you said it, and especially you highlighted the situation with the state. And I will say when it comes to HHS issues, this is the number one issue that I'm hearing, at least from people in my community, in my district, number one. And I'm gonna say right here, it's right on top of my list on things that I'm gonna be supporting from the reconciliation list. This is something that we need to secure and support because it's vital services. So thank you for that. Next, I have Councilmember Kristen Mink.
Thank you. I wanted to thank the Commission on Aging for their work and their advocacy, both for this budget as a whole and also for the couple items that I lifted up in the memo that I sent over with Chair Sales. And I also wanted to thank Councilmember Balcom for joining us in the request for the $60,000 to support the launch of villages in underserved areas. And I hear you, Dr. McGee, and I think that it's really important that we are in alignment with the department as we tackle this work. I think it's an important conversation, and I appreciate the Commission for furthering the conversation as well, a conversation that I know you all have internally also, but I think is important to bring to our attention here, because we all know that the work and the return on the really minimal investment in villages is huge. Is huge. It really benefits a population that is growing very much right now, and the villages are a powerful tool in making sure that this population is served. There are other pots of grant funding as referenced, and I'll note that the Tamarack Triangle, a village in East County, did secure, and I was glad to support them in that effort, to secure some state funding. But to your point, that grant funding does not solve the problem of ongoing support. And so, the recommendation that we got in this proposal was to have this be a grant that essentially targeted organizations that have existing relationships in the community, to provide them with some seed funding to help them get groups started within populations with whom they're already connected and are going to stay connected, because that consistency that they provide by having those connections would help to create that longevity. And in the course of those conversations, something that I also heard was, in addition to us not really tapping into the full potential in East County and in Up County, that there are also just pockets of the population, not necessarily a geographical sense, but when we look at, certain pockets of our immigrant population, different pockets of our populations where we're really also not reaching them. And so I think as we move forward, thinking about how we can support the work of reaching all of the folks who are not being reached yet is going to be valuable work for us. So really appreciate the work you all do there and for the conversations. This is only a 10K item, but I did want to lift it up for colleagues in case we're able to squeeze it in. This was also a request of the Commission on Aging. This is for their annual public forum, which they have been holding for a while. And noting that, seniors are outpacing, as we know, other age groups. They are becoming one of our largest demographics. And so thinking about how we can really be intentional and inclusive with the outreach and engagement there, this is a relatively small investment that is going to go a long way in that space. They've been holding this forum for a while with older adults and their caregivers to learn about emerging issues and county services, hear from experts, share needs and perspectives, and informing the Commission's work and advocacy. And I have been really impressed looking at the output of what has come out of those forums. For example, last year's forum resulted in the sponsorship of a state bill to study the impact of a universal caregiver stipend, which was passed. That bill was passed by the General Assembly. So they're really doing some stuff in there, and I really appreciate that HHS and that the county has always managed to find the funding to support that work, recognizing the importance. So the difference here is that by having that funding guaranteed and known at the beginning, that's going to allow them to be a lot more effective in how they put that the forum together and be able to, for example, address issues of accessibility to make sure that they have the AV to reach folks who are not able to come in person, interpretation, all those sorts of things that they need to know that they have the funding for, with a longer timeline to make sure that this really is accessible to all the people who would want to participate. It would just allow them to be able to do that more effectively. So as we move into reconciliation, I hope colleagues will keep that in mind. And I yield. Thank you.
Can I add a comment, please? I'm so
Yes,
sorry.
go ahead.
So we weren't able to get it in time enough for the packet, but we were working with the executive's office and trying to get more information from the and maybe DHS just wants to say this, from the council attorney. There's no precedence for adding funding for a board, commission, or committee. There are some, like the Community Repair and Reinvestment Fund, they get allocated funds from the state, and we were told to establish a board. But within HHS, there are programmatic funds. There's operational funds for, to help support their wraparound services. So I think there was just some concern when we've been talking to OMB about how that would actually be utilized, because like Commission on Aging doesn't have like a cost center. They're not a program, they're a board, a BCC. So we're just still looking into the legalities.
I appreciate that. If there's a technical adjustment that we can make to essentially put it in the HHS budget, right, but have it be known that this is the purpose that it is for. That's really all that is necessary here, is to allow for them to begin their planning in advance and begin to spend a little earlier as needed.
I'm going to turn it to the director. Please, can you
Sure,
discuss
thank
it?
you, Madam President and Councilmember Mink, and thank you, Ms. Clemens Johnson. We definitely don't want to set a precedent for our boards, commissions, or committees to have a line item. They don't have a budget, and so we would have to continue to work with our Office of County Attorney and our executive staff to see if this funding was available, how it could be used, either through Dr. McGee and Aging and Disabilities, but this is for all of our boards, commissions, and committees. By administrative procedures, they should not have a line item budget based on my understanding and read and what I've been advised. So I just wanted to share that with the council as we work through this budget session. We understand the use and the need, but we want to not set a precedent and make sure that we are consistent across all of our boards, commissions, and committees, because we have newly formed boards, committees, and commissions that will see this and think that the money or the tranches of money that are earmarked for them could be used in a similar capacity. And we've been very diligent to provide them with the guidance and recommendations.
Thank you so much for that. I'm going to turn it to legal staff for a second.
Sure.
I just want to confirm with our legal staff first, please. Go ahead.
Yeah, I apologize, but this is the first that I'm hearing of this issue, and I will need to look into it. I believe it sounds like the county attorney's office has already perhaps weighed in or is looking into it, and I'm happy to liaise with them and circle back.
Yes, I'm going to have to say that we're going to have to hold this particular item. I see the need, but if we cannot do it, we should not do it. So let's just hold on that one when we vote, and we still have tomorrow. We can bring it back tomorrow, and that way you have time to check with the attorney's office from the county. Okay.
That sounds fine and reasonable. Agree. If we can't do it, we can't do it. And so, yeah, happy to check in as well. Appreciate the conversation. And I'll just note on the question of like, if we do it for one, then we have to do it for all. I would say that actually I don't necessarily agree with that. And because in this case, this is a particular forum that has existed for many number of years, has a proven track record. And, we do choose what we fund for various reasons, and I think that this would be a legitimate one, but understand that it does become a trickier conversation to have. Thanks.
I'm going to turn it to Councilmember Lukey.
Thank you, Madam President. So based on the discussion we've just had here, I believe what the motion is for the body is to approve the committee recommendations with the exception of the addition for the $10,000 on the particular line item related to the Commission on Aging, which we will pull out and address separately as we work through these issues. So that's my motion. I'd like to move approval of the budget as recommended.
We have a motion. Can I get a second? Second by Councilmember Evans. All those in favor, please raise your hand. It passed unanimously. Thank you very much. We're going to move on to before we move to item 5, we have a comment from Councilmember Will Jawanda.
Thank you. We went so fast through the last item that I didn't get to bring this up, but we have the people here to address it, and I'm not going to make a motion, but I am going to tell you what I'm going to do and why, because I think it's important for colleagues to understand. So the Community Connect portal, which was under the last item, Mr. Rodriguez Hernandez can come up for that. It's been before this council several times since FY22. And in 4 fiscal years, it's spent just around $6 million in IT consulting and technical services with 2 different vendors. The HHS committee in its deliberations and in the staff report acknowledges that 75% of that $5.9 million has gone to development and enhancements and 25% to maintenance. We passed a $2.2 million supplemental on Tuesday, and the enhancement that's before us today, the $2.5 million enhancement, that will bring our total county investment over $10.6 million next year in this portal. And we're getting 6 DHHS programs in the portal. They're important programs: the adult dental, senior dental, care for kids, working parents assistance, community head start, and rental assistance. But that's not all it was supposed to do. And now we're being asked for $2.5 million for further development to expand a portal that hasn't delivered its initial scope. And we still have the question of what agency is going to own the system. And I appreciate the HHS committee structuring the recommendation to acknowledge that question. So they placed the $2.5 million on the reconciliation list in 2 tranches, and then $1 million for continued development, and then $1.5 million for the maintenance of the current system, which is important. So we have a way to delineate this, but council staff went further in the packet. They said, and I quote, "Recommend that the committee consider only funding costs to maintain the current version of the Community Connection portal without further development to allow for the executive branch and council to review the future scope and funding needs of the CCP." I agree with that, and I was going to make a motion, but we already passed it, so I'll just say what I'm going to do. I will not be supporting the continued development tranche. I don't think it's appropriate at this time. I do think we should keep the maintenance on the reconciliation list, but we really have to get to the bottom of this. It's been frustrating for me just as we've talked about it over the years, and I want to give you an opportunity to respond, but I think this is something that we need to make sure is actualized, and I know we had the go, no go conversation on the 375 that Gio talked about, which is important. But this is a lot of money we've put in this over the years, and I'm a little concerned we're not where we need to be. So with Director Bridges or Mr. Hodge, if you want to respond, but my recommendation to colleagues is that we not support the enhancements, and that we just support the maintenance at this time until we figure this out. Go ahead, Doug. Mr. Director
My name is Mark Hodge. I'm the Chief Operating Officer for the Department of Health and Human Services. This request for $2.5 million gets us to the end of our original scope for the Community Connect portal for HHS. And so we'll be adding additional programs into the eligibility system for this final year. The hope was that, and I think the long-term plan, and certainly the county executive has spoken about this in our leadership meetings across the county about a one-stop shop. This is the perfect system to use for expanding that outside of HHS. And so it is a conversation that we've been having with TEBS. We had hoped that would have been moved over to TEBS previously, but it has not. So HHS currently owns it, and for the foreseeable future owns it. But we want to make sure that we get the final programs into the system as the original scope required. And so, yes, it does get us to over the $10 million mark, but it is the last time that HHS will be coming before council to ask for additional funds outside of maintenance. And so if the council decides that that you are only going to fund the maintenance piece of that, we will keep the lights on. We will not be able to expand into those final programs, and we for the rest of our lives maybe we'll be just funding the maintenance of this until a future county executive or council decides to add more pieces to this, or that TEBS decides to expand this outside of HHS. But for now, we're happy to keep the lights on if that's what the funding is. We'd be happier to be able to finish our original scope if possible. But for now, it is an HHS-owned system, and we'll continue to maintain
and those
it.
4 programs, the additional programs are that you would be seeking to add this year?
So there are additional CEF programs.
Right.
So we want to get all of our
Rental
county
housing.
eligibility programs into that. So if you are eligible for a system or for a program, we want them to use the system as opposed to paper applications. The state already has their own eligibility system for Medicaid and for SNAP, things like that. Our county system will use only county eligible programs. Montgomery Cares is in now, but also we want to add Care for Kids, some of our senior dental, some of the other across HHS eligible programs that people can use the online system for. We want to be able to put that link on the county website so anyone can access those systems, can access the system to apply for any of those programs. The nice thing, as we've talked about previously, is that once you apply for one, all of your information is already in the system. So when you apply for a second, you don't have to resubmit all that information. That is not true on paper. So when they have to submit applications on paper, they have to resubmit all that information, including how much they make, what their rent is, all the other things that are required for eligibility programs. So like I said, we would love to be able to finish this project, and we hope that we're able to do so. But we will keep the lights on with sufficient funding as well. We can't zero it out because we'll have to turn it off.
Yeah.
But otherwise, we can keep the lights on and in hope for future development.
Well, I appreciate that. We all want it done. That's why we've invested the money into it. But I think I appreciate the responses, and we can deal with this outside of budget. But I just wanted to make that point. Thank you, Madam President.
Thank you for bringing that up. I think it's a very important conversation, and honestly, I appreciate it. Next, we have Councilmember Kristen Mink.
Thank you for coming back to this one, because it's a lot. It is a lot of money, and the work is important. What you're describing, we need to be able to do. We have to modernize, and we're placing a tremendous burden on both the public and our staff without it. At the same time, the amount of money that has been, and that has been spent on this and is requested for maintenance is completely out of alignment, to be honest. I've logged into the portal. It is not user-friendly at all. And I understand from our conversations, it seemed to me that this would only be useful if you are really sitting next to somebody or sitting maybe on the phone with somebody, an FTE, who can walk you through it. So already we've lost a lot of the functionality right there. It would be great to just put a tool out and be able to have the public find it on our website and say, oh, great, I can fill this out and I can figure out what I'm eligible for, and I can start. That's not it. They would need to talk to somebody in HHS who would say, you are eligible for this, or we should take a look at this, and here's how you fill it out. It is not clear when you go to the portal. Well, first of all, logging in is kind of a pain. There's stuff on the landing page that looks like buttons. They're not buttons. It's a whole thing. But even once you log in, it's not exactly clear what benefits you are applying for. There is no button to apply for rental assistance at all when you go in. And so then that's when I found out that somebody would have to learn that they are, I guess, eligible for that, and then be provided with, I don't know, a link or a code or something that would then allow them to fill it out. So this is saving some staff time, but not all the staff time that it should, or that I think members of this council expected, as we've been talking about the size of the investment that we've been making over time. So I think that this contract needs to be renegotiated in terms of what you are getting for what you are spending. I have seen a lot fancier, more effective websites for a lot cheaper, to be very, very honest. I appreciate that we're looking for our nonprofit contractors to be able to use the portal to upload their invoices instead of sending them through email. I also think many of us have probably worked for nonprofits for whom you can do that, and it didn't cost $10 million or $2 million to build and $2 million a year to maintain. I'm confused by the 300 plus go, no go, go. There's like $8+ million in it. Go. So it's a lot of money into a space that when I go and log in, I find definitely does not read like an $8+ million investment. So I think we need to keep the lights on, but I think even with partial funding, and we don't know where we are even in terms of, we don't know where we are completely yet, but we know that it's a tough reconciliation list. I don't think nobody wants to shut down services, and we would like to see this work move forward. But whatever funding we're able to get for you into this space, I would ask that you take a look at the possibilities of renegotiating or working closely with the contractor or TEBS or however you want to do it. But we've got to find a way to be getting more for the money than what we are currently getting. It's not sustainable.
Thank you. Next, Councilmember Kate Stewart.
Thank you, and I appreciate Councilmember Jawando just referring back to our TEBS discussion on Monday, because that was a long time ago. And I just want to note that when this actually came over as a supplemental a few months ago, on the GO committee, we did work with TEBS to think about what they needed for a go, no-go and expanding, and we got the money down from an $800,000 request to the $375,000. So I do see a lot of things linked, obviously, in our budget, so I just wanted to highlight that for folks that the TEBS has already been thinking through and reduced the ask for that go, no-go project.
Appreciate that. Next, we have Councilmember Don Lukey.
Thank you, Madam President. And I, too, I recall, and I'm sure everyone sitting here today does, too. I know Director Roper's not here before us, but the joint GO HHS committee session that we had, where we had a very robust discussion about these issues and a lot of concerns about this moving forward. And to be clear, the committee's recommendation was to break it into the two different buckets, so that both of which are on the reconciliation list. So both the lights on option and keeping things as is, and the enhancements. My big concern, and this is not the only item that the council's had before it this week, where there were decisions about who's owning what, weren't ready for budget. And yet they have significant budgetary impacts and or should be things that we should be able to talk about robustly during the budget session. My concerns with this echo a lot of what Councilmember Mink had noted, and I definitely appreciate our co-chair, Councilmember Stewart, and her work in reducing down what TEBS needs for that analysis. But to Councilmember Jawando's point about the money's already spent, we really as a body, and this is my pitch to my colleagues as we look at the reconciliation list, this was not a purpose-built system that allows the hanging of new ornaments on the Christmas tree every time you want to add a program to it in terms of its IT functionality. And it has not been managed by TEBS, which is the county's IT entity. And at this point, TEBS has not even indicated that they want to manage it, right? And those are really critical points in any type of large-scale IT system, particularly when it needs to serve the public and isn't just a back-end government tool, but when it needs to serve the public so that we are not having I'm using a magic number, 11 billion calls for assistance, for technical assistance, for a tool that we put out that was supposed to make life easier for our residents, right? And so I have significant concerns about all aspects of the funding related to that particular project, not because I don't want us to have a portal as a county. I do believe that having a portal that's functional and provides a one-stop shop, one door in for our residents on all these different services so that it's seamless to them, note the word seamless, is critically important. But we also have to be good financial stewards in how we do it. And we really need careful consideration of what has already been expended and how we get the best solution moving forward without putting more money in a high volume with a low yield. And with that, I'll turn it back to the Council President.
Thank you. Next, we have Councilmember Shara Evans.
Good morning, right? Yeah, it feels like afternoon. Good to see everyone. And so we did have a really robust discussion at the joint committee meeting. So I'm a big fan of the Community Connect portal. Can people, does it work right now? Okay. So is anybody experiencing any issues with it in using it?
Yeah, not to our knowledge, and there is a mechanism for them to send in a concern or help desk ticket, for lack of a better term, that then gets addressed by the contractor immediately. So we're not aware of any issues that may have come up from that.
Okay, so I'm not going to bring up the committee discussion, but does it provide savings for staff, for the users? In terms of being able to go to the website and being able to access it, it saves time on HHS end in terms of the application getting through really quickly. Or am I saying this wrong? Just from what I remember very vaguely. I mean, it is a savings of time when the Community Connect portal is used, correct or no?
For the resident who's accessing it, yes, because they're not driving to a county building, they're not waiting in line for their number to be called. So in essence, their time is saved by being able to make these applications online. And because they're not having to fill out multiple applications, their personal information, their financial information is all saved in the system. They don't have to keep repeating that. So again, a time saver for the client or for the resident as well. Is it a time saver for our staff? Likely, but not yet, because we haven't realized the full potential of it yet. But it is our hope, and we've gotten in trouble in the past for claiming that this will help our staff. So we try not to say that too specifically, because then budget gets taken away from our staff. But it is our hope that that the number of staff hours that are required to spend with one individual decreases, and so then they can access more time with more individuals for that.
Thank you. I just needed a quick refresher. Okay, I yield my time. I'm done.
Thank you very much. Now I'm going to turn it to Councilmember Lori Ann Sells.
Thank you, Madam President. Thank you to my colleagues for the comments. Having had to experience spending almost an entire workday at the Department of Social Services when trying to recertify for rental assistance, utility assistance, SNAP benefits, and everyone has to get recertified. Everyone has to bring in multiple documentation, pieces of documentation. Hopefully you have childcare or you're bringing your children with you. Luckily, this system has now provided a one-stop shop entryway that is a convenient, accessible way for residents who we are hearing don't feel comfortable coming into government buildings, don't feel comfortable sitting with a social worker and going through their documentation. We've talked about distrust with the government, especially in our low income and communities of color, and those who have language barriers. I believe this is available in 5 languages, Dr. Bridgers?
Seven.
Oh, see, I was off. 7 languages. And you can go to any of our Department of Social Services, and we may not even have 7 different social workers who can speak 7 different languages. So then you have to wait and maybe contact the language line. So you're further and further delayed. And at a time when residents are seeing their benefits cut at a moment's notice, we need to ensure that we are providing the easiest pathway. And any change, especially with technology, is going to be costly. I appreciate all of the concern. I know we are in a tight budget season. We're looking for savings everywhere. But if we're going to cut off this program now and limit how we're doing things, we haven't even gotten through the full HHS budget. We're also going to be thinking about cutting positions, basically, because the increased demand that HHS is seeing to do other things, this will only enable our social workers, which we are limited in capacity already, who are stretched thin. If we do not streamline and get this program right now and have an understanding of what sort of benchmarks will be met at each phase and how much it's going to cost, I'm open to having that discussion, but I am not accepting any cuts to no more progress or seeing how else we can leverage this system to create even more accessibility for our residents. And they can only do that if they assess what other programs and services they can integrate into this one-stop shop. So I would encourage, my colleagues to set up an account and truly try out the ease and accessibility of this system. And I've never received a message in my inbox from any residents complaining about accessibility or needing anyone to sit with them to navigate the system and fill it out. And can you remind us how many applicants have come into the system from when it started to now? What are we seeing?
Can staff answer that question? Can you repeat the question, please? Or maybe you have it, Nicole.
Yes, sorry.
Ms. Nicole
Just
Rodriguez.
pulling it up from the packet on April 10.
Thank you.
Yep. So far, okay. So in 2024, there was 191 applications. That was the first year it rolled out opening for applications. And then in 2025, there were 1,041 applications through the Community Connect portal.
Yes, and the more people know about this system, the easier it will be for residents to know that this is an option. All of the service centers are now equipped with computer portals. So whether they do it at the library, their cell phone, or they go to one of the centers, they have an opportunity to access services on their time. So I just implore you all to just think about the savings and ensuring that our residents truly can access the services they need without fear. So I will yield. Thank you.
Thank you so much. Just a reminder, this item is in the reconciliation list. We're not voting today. That's for next week. The last person I'm going to ask to talk about this issue is Mr. Glass.
Thank you. I know it's on the rec list, but lots of conversation, and I want to pick up right where we left off with the point of utilization. Can you repeat what the utilization rate is or numbers?
Sure. In 2025, it was 1,041 applications. In 2024, it was 191 applications.
How much has been invested in this program already?
At the conclusion of fiscal year 26, it'll be about $8.1 million.
Say that again.
$8.1 million. At the conclusion of fiscal
$8.1
year
million.
26.
How much is being requested in this budget?
$2.5 million for fiscal year 27.
And how many people are using this?
Last year, 1,000.
Thank you.
Thank you so much. We're going to move on to the next item of the agenda. But it was a great conversation as we vote on the reconciliation next week. As a reminder, it's a long reconciliation list, very long, and we do need to make some reductions. Think about that. Number 5, we are going to deal right now with the Department of Health and Human Services, Behavioral Health and Crisis Service. I'm going to turn it back to Councilmember Luque.
Thank you, Madam President, and welcome Chief Monica Martin up to the table. So with respect to the votes taken on these issues, they were all unanimous recommendations. I do want to walk through a couple of pieces of nuance to this. So there were several items that the committee unanimously recommended, which are not on the reconciliation list and are not subject to being on the reconciliation list. That is the $300,600 for the substance use disorder interventions and evidence-based prevention for upper elementary and lower middle school grades, which is funded through our opioid abatement funds. Crisis Center contractual conversion, another adult drug court case management contractual conversion. Again, these were zero cost matters. They're just changes in the functionality as to how it will be listed within the department. We had a decrease in the cost for the human services contract with the Maryland Treatment Center based on previous actuals. So we accepted the recommendation and that adjustment. The elimination of expenditures funded by the American Rescue Plan Act mental health grant. That grant ended, so that is noted. And then the final non-reconciliation list was the elimination of wraparound youth services contract due to duplication with our Medicaid targeted case management, TCM and TCM Plus. Now, for the things we voted on that are subject to the rec list, and I wanted to give Chief Martin and also our staff some time to talk through those because there were a couple of critical issues there. And then I'll turn it over to the ENC Chair, Jawando, and Councilmember Katz, who submitted a letter requesting linkages to learning program for Twin Brook Elementary School. And we'll cover that at the end and let them speak to that. But we have a budget item for replacing operating budget impact associated with the Diversion Center, Behavioral Health Crisis Stabilization Center. This is a $3,104,903 item. It says it will be on the rec list, but here is my question. Because the funding that is required in order to accomplish this is this is work that must be done under COMAR in order to be compliant with state law. Therefore, my question for Chief Martin and for Ms. Hernandez-Rodriguez is Rodriguez-Hernandez, I did it backwards, is whether that truly is something that should be on the reconciliation list if, in fact, it is required by state law. So
Thank you, Councilmember Lukey, for that overview and for the opportunity, again, for the record. I'm Monica Martin, Chief of Behavioral Health and Crisis Services. So let me speak to the impact of if this is not funded. Let's talk about it that way. So if this is not funded, then the brick and mortar renovation that already started last week through the CIP allocation that will result in a renovated and expanded behavioral health crisis stabilization center being available to us as a facility in fall will not operate at all, not even the way that it used to under a smaller scope. Also, it would mean that when it comes time for the renewal of our state licensure for that unit, which is due in December, we would not be able to renew the license. And that is undoing about 3 years worth of work with regards to, and even more really, if you think about the whole diversion center project, because the reason these requirements came to be, as outlined in the packet, is that behavioral health crisis stabilization centers under COMAR regulations that were released in May of 2024 require the ability to serve walk-ins, so not just emergency evaluation petitions or involuntary clients. They require the ability to serve residents across the lifespan, so requiring us to serve minors, youth, children, and adolescents. They require the offering of seclusion and restraint when absolutely needed as part of the milieu of supports available in a behavioral health crisis stabilization center. And so while we were very focused as a county on diversion, of course, from emergency rooms and the criminal justice system in the development of the center at 7 Lotz Road, that was always designed as a facility and continues to be to serve adults and, again, to be a facility that works in very close collaboration, again, with our public safety officers in doing that effective diversion. So if we do not have the ability as a community to serve walk-ins and to serve our minors who deserve the support as well, of course, not just adults in our county, then the whole project, the whole two-site project really is at risk. And I will just highlight that not only do we have a license, we have accreditation under Medicaid. We were able to start billing for the stabilization unit before it closed just a couple of weeks ago. And we did also pass CARF accreditation for 3 years for that service. So while we are currently not operating, the idea is to, ensure all of that is in lockstep and in place for the fall.
I'm gonna say something really quickly. These items are going to be listed in the reconciliation list, just like the ones that we talked yesterday and in the one in PHP with the FBI. These are things that we must do, and they're going to be listed in a special column. You'll see that once we're done with this process this week. So this is part of that.
Yep. Thank you for that, Madam President. And I thought that it was a significant enough thing, particularly in light of the companion capital budget item, that everybody should make sure they understand they go together, they work together, there are state requirements, and what the impacts are of that. The other two pieces that go together and are in your packet, the county executive sent over a reduction in our residential rehabilitation provider supplement, and it is a substantial reduction. It was $458,422. The council did, or the committee did, concur with the reduction. However, we concurred because we know we are in difficult fiscal times. That being said, I moved to add at least a 2.5% adjustment up, because we are giving that in other spaces within our HHS service, which isn't a significant amount of money, but that is why there are two items that you see that will be on the reconciliation list. One is a reduction that we agreed to, the other, or sorry, not on the reconciliation list, but one is a reduction. The other was an addition of a 2.5% inflationary adjustment for residential rehabilitation supplement, and wanted to clarify what that program is for those who don't get in the weeds on the HHS stuff, but those are our programs like Cornerstone Montgomery and Shepherd Pratt, and they run programs that stabilize, provide stable housing and supports for individuals with behavioral health conditions. And so, again, wanted to give Chief Martin an opportunity to speak to that if she would like, before turning it over to our ENC chair on the out-of-school time programming. Thank you.
Yeah, sure. Yeah, these services are part, of course, of our public behavioral health safety net. These are state designated beds that we can only provide as many beds as the state allows us to allocate every year. So while the supplement is provided here locally by Montgomery County, we are, to our knowledge, the only jurisdiction in the state that provides a supplement at all. So it's shared in committee. This is was recommended as a cost containment measure, a necessary one given balancing our budget. In terms of the services, these are long-term structured housing and rehabilitative supports, as it says here, for adults with serious mental illness. You'll see there's not a lot of turnover in those beds. There's 365 beds in Montgomery County, and this year they're expected to serve about 412 individuals. But the supplement specifically is, again, on top of the fee for reimbursement model, and so it's been utilized for services that are above and beyond what the state reimburses for.
Thank you.
Thank you. Thank you, Madam President. Thank you, Councilmember Lukey. So this is on the school-based mental health and related services. Ms. Rodriguez-Hernandez, do you want to, and then we can also address Councilmember Katz's linkages and the great Twinbrook Elementary folks who are in the audience today. Thank you.
Yes, and I'll invite our colleague, Mr. Connolly from MCPS, up to the table
Yes.
as well. So there were no recommended budget changes for the Behavioral Health and Crisis Services school-based mental health and related services program area. However, as noted, Councilmember Katz did transmit a memorandum to the colleagues on the Joint Committee for the addition of what we call the small linkages to learning team at Twinbrook Elementary School. And so this would allow for one full-time therapist and one full-time family care manager to be included into the services at Twinbrook Elementary School for the linkages to learning program. The memorandum originally included $200,000 that the committee unanimously recommended to add to the reconciliation list, but we'll note that after review, HHS did provide a more accurate number at $217,753, and that does not include potential retrofit or renovating costs for the existing classrooms at Twinbrook Elementary School that would be utilized for the services of linkages to learning, but also would like to note that the school-based health and linkages to learning centers PDF does include $1.5 million in placeholder GO bonds starting in fiscal year 29, so that is also an option tied to the capital project and the operating budget.
Thank you very much, and that was unanimous. And Mr. Connolly, anything you want to add? I know we talked about this in Joint Committee, that you have you're innovative in finding space for these great programs to happen.
Absolutely. So we actually have three alternatives. One non-capital solution would be the school is here, they're going to make it work. It would revolve a lot of shifting with some of the staff members, but they are willing to make it work. So that's the non-capital solution. We've already taken a look for the interior fit out of a room, but we also found another portable it's primarily based as office setup. It was over at Emory Grove. It's now at Blake High School. So there is an option where it's a board-owned portable, and we could set it at Twinbrook. That is another option. Each one of these has a trade-off, whether it's cost or program adjacencies, things like that. So we can talk through that, but I think you can see the school's willing to make it work, and we will make it work.
Got it. So it would be 217. I guess would be the adjusted amount, technical adjustment instead of 200,000. But it was unanimous, and I think this would be awesome. So turn it back to you, Madam President.
Councilmember Katz.
Thank you very much. Thank you to the Joint Committee and Councilmember Juando, and thank you to the school. I appreciate the hand waving in the back. I think it should be noted that Twinbrook is the only Title I community school in the Richmond-Montgomery cluster. It was added twice to the CIP budget and removed. It has a farms rate of 70.6%, and the proportion for the emerging multilingual learner students at over 41%. It's a critical need. I appreciate the schools working with us and your positive attitude as well. And to the 217 or whatever the right number is, I appreciate whoever figured out the exact number. But this really does have to be done. It's past time that it should be accomplished. Thank you very much.
I'm a big fan of Twin Brook Elementary School. I have done events over there. Although it's not in my district, I feel like it's mine because I have many residents who go there. So it's like 2 blocks from my line. So it's one of the wonderful things that I share with Councilmember Katz, and the need is there. Thank you so much for highlighting that. Was there anything else that we missed in this particular packet?
No, we reviewed the reconciliation list items and the CIP amendment and committee.
So beautiful. Thank you so much. With that, is there a motion to approve the behavioral health and crisis service budget as amended with the technical changes that were addressed?
So moved.
Moved by Councilmember Don Luque, second by Councilmember Katz. All those in favor, please raise your hand. Any passed unanimously. The last item for the morning is the Department of Health and Human Services to end and prevent homelessness. I'm going to turn it back to Councilmember Luque.
Thank you, Madam President. Look, we're keeping this train on the tracks. All right. So in the Services to End and Prevent Homelessness budget, there are 4 items that the committee approved. 3 that the committee approved without objection. And yes, I'm going to turn it over to Councilmember Friedson to deal with rental assistance, but I'm going to cover the non-rental assistance stuff first. First was we approved without objection one-time additional funding for our SHARP program for families that supports our families. One-time funding for overflow emergency shelter support for families. Which again, we know that we'd like to reduce our reliance on that, but we are still working through that and making changes. And I appreciate Chief Hong and all that you do. And then we approved without objection an item for the reconciliation list to fill our adult shelter budget gap with general funds. The piece where there was no vote technically taken at committee, or it was not, not everything could be heard, I'm going to put it that way, but I think we had a common understanding, and that was with respect to filling the outreach budget gap with general funds in the amount of $438,909. And I just want to be clear, that is to sustain the existing homelessness outreach budget existing contracts. And so to clarify, the FY26 operating outreach budget was $1,563,775. The encumbered amount is $2,002,684. And that reflected why the FY27 budget was proposed as it was, to include inflationary adjustment. That includes our Every Mind, Bethesda Cares, City of Gaithersburg, and Pathway to Housing outreach work. I note this is not an expansion of services. It's really just for the continuation of. And also wanted to note that although Shepherd's Table does not provide outreach services in the way that the other contractors do, its contract is part of the outreach funding, and would also be impacted by the choices that we make with respect to this line item on the reconciliation list. So the reduction to their contract based on the decisions that we make related to this would impact the number of meals served to unhoused individuals. With that, because there wasn't a vote technically taken by the committee, I'd like to move and thank you, Councilmember Friedson, that we do include the $438,909 on the reconciliation list for the outreach item. And with that, I will turn it over to Councilmember Friedson.
Yeah, I'll just be very brief on this. This was a very challenging committee session. We blew through our lunch break, which we didn't have. We went through actually the start of the next committee sessions, which were scheduled to start at 1:30. And so there was a discrepancy, not for lack of support for this item. I just want to clarify, because in the packet, I think it has caused some concern and confusion. Council staff understandably was trying to decipher whether or not we formally took a vote. I think it was the impression, at least certainly of mine, and in conversations with colleagues subsequent, that we accepted this without objection, but that was not clearly said. That could be legible in the tape. And so council staff doing your job. I appreciate you doing that. Could not note this unless we said it in a public session. So I just want to note that this is reconfirming the intent of the committee, which was not actually taken as a formal vote that could be understood publicly. And so for the interest of transparency and process, and for the sake of council staff doing a really good job in that meeting, trying to follow what we were doing, second this, and with my understanding, we took it without objection, but I'm glad we're confirming it here.
We have a motion and a second to clarify the committee's recommendation. All those in favor, please raise your hand. And it is unanimous. Thank you. Is there something else from Councilmember Lutke on this?
No, I've covered my aspects of it. I was turning it over to
Yes.
Councilmember Friedson as chair of PHP to cover the rental assistance portion of the packet.
Yeah, just want to make sure that you were done. Okay, go ahead.
Thank you, Madam President. Thank you, Councilmember Lukey, for stepping in to give the committee's report and really managing the whole morning so well. This is always difficult. I was talking with former Councilmember Albernaz earlier this morning and laughing with him. How's your morning going? Probably a little bit better than it would have been, because this used to be his job for HHS Day, which is always, among the more challenging of that. The Joint Committee session, we considered the potential use of non-tax supported housing initiative fund dollars to reduce the amount of general fund support required for SEF, essentially backing out funding, which would have eased the pressure off the general fund. Ultimately, that was a suggestion from staff as an option, and ultimately we opted not to do that. Council staff noted that in previous years, the council has applied additional recordation tax revenues to certain DHHS programs, such as rapid rehousing, to offset general fund expenditures while maintaining total program funding and freeing general fund resources for reconciliation. Council staff have advised that up to $1.452 could be reduced from the contingency and reallocated to other SEF or DHCA programs. Essentially, that would ease the burden, a little over $1.4 million. The discussion essentially centered around the idea of whether or not we were willing to take $1.4 million of what is effectively a cushion to allow for the department to have flexibility at a time when there are massive concerns with what is happening at the federal level. And ultimately, it was a unanimous decision of the Joint Committee that, especially given the current circumstances that we are in, when we are going to have to backfill what have traditionally been federally funded and federally supported programs that are going to dwarf by orders of magnitude, unfortunately, 1.4 million, tens, hundreds, maybe 1,000 times, not hyperbolically, the level of support here, that moving this funding away and limiting even further any modest level of flexibility that we can provide to the department to help our vulnerable residents avoid experiencing homelessness and to rapidly rehouse them as quickly as possible was just not something we were comfortable doing. It's a practice that has happened in the past. I think there are moments when it would be a reasonable practice given where things are, but given the moment that we're in, it was the unanimous position of the Joint Committee not to accept that. And so we didn't, and we would have to revisit, effectively the SEF and DHCA conversations based on the federal impact as we move forward anyway. And I will just note, because I think this relates to other decisions that we're going to make when we talk about reserves and where we leave ourselves, I want to use this opportunity, if I can, to remind colleagues that this is a perfect example when we think about what the reserve level is going to be. If we drop the reserve level down very close to the Revenue Stabilization Fund, that would mean there will be virtually no dollars available to respond to a new need, including a federally funded need that we did not appropriate. The Revenue Stabilization Fund can only backfill appropriated dollars that the revenues do not meet. And so if there is a 10% reduction in revenues, we could backfill 10% effectively of an allocated budgeted item to maintain services. We cannot backfill federal abandonment of their responsibilities or a decision that drastically increases needs that we did not foresee to add funding, including those who are experiencing homelessness. So I just think it's important because it's related to this item and the 1.4 million that we decided not to move to give that flexibility. This is essentially giving a modest amount of flexibility that our reserve decision will do on a much more macro level and a much more significant way, acknowledging that 1.4 million or whatever reserves we end up with are not going to meet the full impact of those federal dynamics. I just wanted to give the context. That was the committee recommendation, did not accept, but appreciated the staff recommendation. And with that, you have the unanimous committee report.
Thank you very much for that. I'm going to now turn it to staff. If there's anything else missing from the two co-chairs on everything that was said, no? So I'm going to open it up to colleagues. I'm going to start with Councilmember Kristen Mink.
Thank you. Appreciate the work of the committees and wanted to express and it was a pleasure joining you for important conversations. And glad that we got, glad that we landed where we landed. I wanted to also show my support for the contingency being where it is that's not necessarily where it always is. And I wanted to appreciate the department for the communication and I know the ongoing collaboration that is planned because of the dynamics at the federal level and the level of unpredictability. It's not even necessarily how many people will need rental assistance. There are many pieces in flux, and so appreciate that CEF and DHCA are going to remain in constant communication throughout the year to make sure that these funds go to fill the highest needs, which we know the needs are going to be there, but really appreciate that there is a plan for ongoing communication and collaboration as we navigate this kind of unknown terrain in front of us. I also wanted to highlight the SHARP funding and appreciate the work of the department, but also the full council's support for SHARP funding and really moving that forward as a really impactful initiative. And I love that it is labeled in the line item that the support from the department and from this council for SHARP funding has in fact reduced the expenditures and provided savings in the moteling costs. That if we had not moved those funds moved and supported in the budget and then moved an additional appropriation, obviously the more we can do, the better. But we can really see the return on the investment within a single fiscal year here in front of us. And so I just wanted to give Director Hong just a moment to speak to that dynamic. And I was really moved by seeing in your presentation at committee that even as the number of families presenting has increased, that because of the tools that you all have and the work of your team, our rate of homelessness for families is going down in the opposite direction. And that is because of intentional work and strategizing and investments such as the one that we have before us. So I wanted to give you a brief moment to speak to that.
Thank you, Councilmember Mink and full council for your support of this program. I'm Christine Hong. I'm the Chief of Services to End and Prevent Homelessness. And I'm really privileged to just speak about the county-wide collaboration that has been SHARP because it's been really incredible to see our county prioritize investment in something that will lift our families out of homelessness more quickly and is much more cost-effective than moteling, because we are moving families out quickly and they're not having to stay in very expensive motel rooms, which are not conducive to supporting a family. So it's something that I'm proud our county prioritized so that we could reduce the number of families experiencing homelessness, which is reflected in the 2026 point in time count. And I just am very appreciative of the county executive, the full council for your support, as well as our family services providers and our CEF SHARP team. Just really thankful for all of the hard work and collaboration.
Thank you. And noting also that making sure that we are funding the the gap. We don't have SHARP funding for everybody. And so that the moteling, the emergency shelter funds are also critically important. And I will note that my office, my team, I think within the last week, actually, we have had 3 families who we have helped connect to shelter who all had babies under 1 year old. And to know that as they faced eviction and loss of housing, that I knew that we as a county, they were going to have a roof over their head, and that they were going to have a case management to get them into something stable as quickly as possible is a tremendous relief, and does make me very proud of the work of this council and of this county and the executive branch. So thank you.
May I also add, I neglected to also express my appreciation to Councilmember Stewart. While she was council president, added an additional $1 million this fiscal year for us to support more families moving out with SHARP, and that really has driven our numbers down further and allows us to continue the work into FY27, which is why that additional amount of money will be important if it can be supported, because it will continue to cover the amount for families who are housed in SHARP as a 12-month program, as well as allow us to turn our efforts towards individuals as well, which we're all hoping to do with the decreases in family homelessness.
Thank you for that important discussion. And I cannot help myself to say and remind to people, this is why we need more housing, and housing for people of every income level. You cannot say that you're going to solve this problem when you don't see the big picture, that we must increase our housing density. Otherwise, it's a political talking point. Moving on. Councilmember Kate Stewart.
Thank you. Thank you very much, Director Hong. Thank you for all your work and your entire team's effort. It has been incredible. And, I also... I know I do this a lot, is lift up the fact that Director Hong not only is leading the work here in Montgomery County, but now regionally for the Metropolitan Washington Council of Governments. And I think that's really important as we were talking about this work. When we look at the investment we have made, and I did have the honor of being president in the fall, but I'm really glad that was a unanimous vote. Everybody was on board. This council is so dedicated to these services. But there are very strongly regional components to this. And I just want to thank you not only for your work here, but regionally. Councilmember Friedson did an excellent job reporting out on the joint committee and looking at these efforts. And I did want to give you an opportunity, because I think one of the things that is really looming for all of us and underscores the need for the items that are on the reconciliation list is the notice of funding, the NOFO, that will come out in June, and the impact that will have on our community of care, continuum of care, excuse me. And as you get your notes, I know from talking to you about this and the presentations that, that's looking at like a 40% cut to permanent housing. That's housing loss for about 350 people, and that also impacts our landlords, as we're talking about affordable housing, who partner in our housing efforts. And we still don't know all of the, impacts that's going to have, but I think as we're looking at this reconciliation list, there are a number of items that are here on your work, but this is really, those items are really to maintain a lot of the instability that we are seeing from the federal government. So I didn't know if there was anything else you wanted to lift up from that.
Thank you, Councilmember Stewart, for highlighting that. So the work of providing permanent supportive housing and rapid rehousing has been supported through our $10 million plus in HUD funding for the last many years. And we have about 800 people in that housing right now. And the problem with a 40% cut in permanent housing is that we would need to find placements for about 350 of those households. And so it's hugely problematic, because permanent supportive housing in particular is for people with disabilities. And that is what 11 of the 12 HUD-funded programs are. So we are definitely in a place where we are very concerned about the number of people experiencing homelessness increasing as a result of a loss of federal funding. And so the other three items on the reconciliation list, that's to fill the existing outreach levels, to fill a gap. Same with emergency shelter for adults and for families. Those are our crisis response systems. They are essential. We can't, at a time like this, reduce them. And we're looking at this reduction. And we are strategizing internally as well as communicating with the state and with our regional partners about how we may respond. But you're absolutely right. That is a critical issue that will impact our system in the next year. So these budget decisions are so important, and I appreciate everyone's focus on our most vulnerable individuals. Thank you.
Thank you. I just have one other question, and it's specific to MCCH, and I know Dr. Bridges and Director Hong, this is a question regarding their budget starting July 1st, that their contract will not cover the cleaning of Neville Street. And I know, as Chief Smedley told us when he was here, that each of the departments needed to look at, a 3-point something cut, and that decisions had to be made during tough budgets. But if you could speak to that cut in ability to provide the cleaning services at Neville.
Yes, thank you for asking that question. So part of the COVID dollars that were received when Neville Street Emergency Shelter was open, we were able to use some of that funding to provide additional cleaning services. It's about $195,000 a year. And the shelter is very large, serving 200 men year-round and up to 260, frankly, on the coldest nights, close to 300 men in that space. So the cleaning services have been helpful in maintaining a dignified space in a very large shelter. And so unfortunately, though it was something we could cover with COVID dollars previously, we no longer have that funding. And it's very important, and we are trying to prioritize and make very difficult decisions about our system. And we continue to work hard to prioritize housing like SHARP, as well as our crisis response system overall, which is indispensable in responding to homelessness across our county. So it is very important, and we don't have the funding anymore, the COVID funding, which made it possible. So that is why the prioritization fell lower than the other items. Not saying that it's not important, though. I know that's not a perfect answer.
No, I really appreciate that. And, I know there's a lot of things that our Neville, all of our shelters struggle with. I'm the council member with the most shelters in her district. And so I appreciate the work that you all do. And I hope that we can continue the conversations with MCCH, as I know you are, because we also hear from the folks who are there. And we're very glad that we're able to have it repainted recently. That's excellent. But keeping it up is going to be really important for residents. So I hope we can continue the conversation about how do we support them, because there are so many people that we're housing there, and making sure, and I know this is a priority for all of you, it's a clean space where people can truly live there with dignity is really important. So I just hope we can continue those conversations. Thank you.
Thank you very much. Next, Councilmember Don Lukey.
Thank you, Madam President. And I want to thank Councilmember Stewart for her thoughtful questions and comments, because I too share, concerns from a health safety perspective related to the operation of our shelters. And it goes hand in hand. None of these things are done in isolation, and none of these things, all of the programmatic pieces that we're talking about here are intertwined. And when we were talking in the fall about the changes coming to the NOFA, it was anticipated to be less worse than it is now, right? And it's only gotten worse in terms of what the gap would be from the feds, because I think in the fall we were anticipating a 30% change, and now it's anticipated to be a 40% change in funding, which, you know, I want to highlight that because we are talking about people who have already been stabilized and are in our permanent supportive housing programs. And I know we have a long list of people who could benefit from those programs. But we, you know, we want to do our best to get to them as well, but we really don't want folks who are already stable destabilized. That's got to be a top priority. So I appreciate everything that you all are doing. I appreciate the level of communication you have with all of our offices on these ongoing issues, and certainly that you know, we collectively will be collaborating with you moving forward as we navigate these difficult waters for our most vulnerable residents. And with that, I'd like to, not yet, oh, somebody else is in the queue. Never mind.
Councilmember Glass.
Thank you, Madam President. Thank you for the work that you're doing, and Ms. Hong, this is your portfolio, so I'll thank you explicitly. And you know, over the years, especially since you started in this position, having come from the sector, coming from one of our providers, there's been a lot of change, a lot of churn. When 8 years ago, when I joined the council and was the lead for homelessness, we were on this upswing of nearly reducing homelessness in Montgomery County. We had effectively ended homelessness for veterans. We were very close to ending homelessness for families, which was primarily women with children. And then there were national events, regional events that have overtaken it, then global events like the pandemic. And so as we are dealing with this very challenging budget, I have said time and time again that my priority is making sure that our most vulnerable residents get the services that they need, which is primarily healthcare and housing. That is traditionally what governments have been helping with, right? And so I just want to get your perspective. How has the work changed? How challenging is it? And from your perspective, what do we as county government need to do to help you keep more people housed?
Thank you for your question and for your insight and involvement in our work over the years. So I think that with the pandemic, there were so many needs that became deepened and clearer to us. And so one of the things we've worked hard to focus on is to ensure that our preventive work is really supported well, and that we continue to try to prevent as many households, so many of whom were economically impacted by the pandemic and still are struggling to recover, that we would work harder to prevent them from entering homelessness. And that by doing that, we would then spend less on our crisis response, which is critically important for us to be able to continue investing in housing for those who are experiencing homelessness. So I think that what we have learned is that we have to be nimble and be ready to support our community through the changes, so more households aren't destabilized as a result of the existing factors. And I think that we've deepened our collaborations, not just with our really incredible community partners who are so experienced at this work, but also, as Councilmember Stewart alluded to, regionally across the state. And these are collaborations that take time to build and continuous effort. Everyone in CEF knows that we are meeting heavy, and that's the work of building collaboration. So I think we've learned a lot from the challenges posed by the pandemic, and I think that though there are many challenges to come, especially those coming from the federal government and a reduction in resources and housing, we are in a position to respond. We just had our community-wide meeting where we affirmed and recommitted to moving forward together, and that very much is, I think, the way in which we operate. We are one continuum of care, And we have to be unified in our efforts, even though we do so many different things, and that takes constant effort and time. But we are so fortunate to have support from our executive and our full council. You all have been so supportive in these issues, and so many communications with your teams. And I'm just so thankful for what we have in our county and what we've developed. And I know that we will get through this difficult period, and we will continue to see reductions in the number of people experiencing homelessness, because we've had to respond to already tough challenges.
Thank you, and appreciate you elevating it and talking about the continuum of care and the network of providers and nonprofits and the boards and the volunteers. This is what makes it happen. And it is a difficult dance because we are trying to help you and the community today with the needs that exist right now, while also trying to find funding to stem that tide in the future. And so thank you for your work. And going back to the council president's short comment at the very beginning of this conversation, we know that one of the best ways to provide homes for people who need them is providing homes for people who need them. Thank you.
Housing for all. That's what it means. With that, I need a motion to approve the committee recommendation that also includes the joint committee recommendation with BHP.
So moved.
Moved by Councilmember Don Lukey, second by Councilmember Andrew Fitchon. All those in favor, please raise your hand. And it passed unanimously. Thank you so much for coming today, but I'll see you in the afternoon. So we'll be back at 1:30. We're going to be now on recess. Thank you.